Riverside's partnership with PEMS and TEMS really reflect back on Riverside's passion for teaching those who care and heal. So it just makes sense that they would want to extend that care to those that are providing the first response to their patients. And taking the opportunity that we have to educate them so that they can do their absolute best when a patient has experienced their absolute worst day is invaluable.
The mission of TEMS is essentially to reduce death and disability, and we do that by facilitating a regionally integrated emergency medical services delivery system. We know typically from an EMS perspective why a call is dispatched. We get that kind of initial complaint. We're able to evaluate it in the field, and then we transfer the patient to the hospital. But what often we lose sight of at that point is what happens to the patient in the hospital and what happens at the end. So without that partnership, I only get to look at 50% of the information. That 50% of the information can be misguided, right? If I don't have the back half for that other 50% of the information. If I know what the hospital diagnosis was and I know what the final disposition was, and I add that into my 50% information, now I'm looking at was the patient I treated just an exacerbated asthma attack, or were they actually a patient that suffered a pulmonary embolism? That value of making sure that our protocols and how we manage and treat patients then significantly are enhanced or improved, and leading to that patient outcome desired.
The Peninsulas EMS Council has existed since 1976, so that's 47 years of doing this. And Riverside has been a partner from the very beginning. We use science, synergy, and partnerships to create a better EMS system or EMS excellence for the peninsula, the Middle Peninsula, and the Northern Neck, which is our region. If Riverside was not in the picture, we'd lose a model for how health systems should partner with regional EMS delivery system and EMS agencies. We lose resources that we utilize for our programs and services. We lose so much in so many different areas. There would be the hole, if it wasn't replaced somehow, there'd be the hole in the care, and most definitely a hole in the regional leadership.
Another reason that this partnership is so important between Riverside and our pre-hospital providers with PEMS and TEMS, it allows a collegiate spirit between the physicians and the first responders, where we know each other, we recognize each other by name, they know how I care for patients, I know how they care for patients, and it allows for that exchange of information to be much smoother so that the information that the pre-hospital provider can receive from family members and the patient about the condition can get passed to me more consistently and more accurately than if we didn't have a working relationship at all. And again, that just ends up with better patient care.